Welcome to this explainer. Okay, picture this highly relatable yet incredibly frustrating mystery. You wake up with a stiff back, or maybe your seasonal allergies are just really acting up. So you take a pill meant to help you feel better, heal, and get on with your day. But instead, you end up walking around in this sluggish, heavy brain fog.
Why does that happen? If you've ever literally fought to keep your eyes open at 2 p.m. after taking something from the everyday pharmacy aisle, validate that experience for yourself right now. You aren't imagining things. There is a profound chemical battle happening inside your body when you take these medications.
Okay, let's dive into our roadmap for today. We're going to cover 1. The sleepy side effect, 2. Decoding the allergy aisle, 3. Calming the spasms, 4. Quieting nerve pain, and finally, 5. Safe and alert.
Starting right off with Section 1, the sleepy side effect and the central nervous system.
To really understand the medication hangover, we first have to establish the biological battleground where these drugs do their work, and it all comes down to your central nervous system, or the CNS. This is your brain and your spinal cord. It's the absolute command center for your alertness, your thinking, and your body coordination. When a lot of common medications like muscle relaxers or pain inhibitors go to work, they actually act as CNS depressants. To stop a muscle spasm or block a severe pain signal, they inherently have to slow down the overall system. You literally cannot turn down the volume on your bodily pain without also turning down the volume on your reaction times, your focus, and your general alertness.
Let's see how this plays out in the real world with Section 2, decoding the allergy aisle, specifically looking at drowsy versus non-drowsy.
When you encounter a trigger, like, say, pollen or pet dander, your immune system mistakenly treats it as a dangerous invader and releases a chemical called histamine. This histamine attaches to receptors in your nose and your eyes, basically ringing a massive alarm that causes all that itching, sneezing, and swelling. Antihistamines are designed to block those receptors, essentially silencing the alarm. But here's the catch. Where they silence it really matters.
Now, what's really interesting about this is the generation gap. First-generation antihistamines like diphenhydramine, which you almost certainly know as Benadryl, easily cross the blood-brain barrier. The problem? Well, inside your brain, histamine actually helps keep you awake and alert. When you block it up there, you get severe sedation. Second-generation options, like Claritin or Allegra, are molecularly designed to stay mostly outside the brain. They target the histamine in your body without shutting down your mind.
And we absolutely shouldn't underestimate how powerful that first-generation sedation really is. As a stark reminder, in driving studies, diphenhydramine impaired driving performance to the point where in some measures it performed worse than alcohol. Worse than alcohol! And dangerously, people often just cannot accurately feel how impaired they actually are. It is a serious medication that demands serious caution.
So let's break down the big 3 second-generation meds. Claritin offers very low drowsiness and lasts a solid 24 hours. Zyrtec acts fast and is really great for strong itch control, but it does carry a higher chance of drowsiness. And then there's Allegra, which offers very low sedation. But get this, you cannot take it with fruit juice. Apple, orange, or grapefruit juice can actually reduce its absorption. That is a crucial, everyday detail that most people just completely miss.
Now, I mentioned Zyrtec carries a higher chance of drowsiness. How high are we talking? 14%. According to the prescribing information, 14% of people reported drowsiness on a standard 10 milligram dose of Zyrtec, compared to just 6% on a placebo. The big takeaway here is that non-drowsy printed on a box definitely does not mean never drowsy. You always need to test your personal response before a long drive or a big meeting.
You've also probably noticed boxes with a D added to the name, right? Like Zyrtec D or Allegra D. That D stands for a decongestant, usually pseudoephedrine. It shrinks swollen blood vessels to help clear out congestion. But here is the major catch. It's a stimulant. Sure, it might counteract the fatigue of the antihistamine, but it can dangerously raise your heart rate and your blood pressure. If you have heart issues or glaucoma, that D is a massive red flag.
Let's shift our focus over to the prescription desk with Section 3, calming the spasms, all about muscle relaxers.
Remember our chat about the central nervous system? Well, this is where it really comes into play. Muscle relaxants don't just magically target your lower back. They ease spasms by quieting overactive nerve signals way up in your brain and spinal cord. The core trade-off here is completely unavoidable. Reducing that muscle tightness inherently creates a sedative effect. It causes fogginess, slower reactions, and that heavy, sleepy feeling.
Clinically, we divide these into a few practical groups based on how they're used. You have centrally acting drugs like cyclobenzaprine, which reduce CNS signaling for short-term acute spasms, like if you suddenly throw your back out. Then you have drugs like baclofen, which are primarily focused on severe chronic spasticity, like what you might see in multiple sclerosis. Because your body metabolizes them differently, their half-life's different too, and that drastically affects how strong the sedative effect is and just how long into the next day it's going to last.
But the drug itself? That's really only half the story. Your unique body is the other half. Several factors can drastically magnify how sedated you feel.
Higher doses, obviously. But also, if your liver or kidneys happen to clear medication slowly, the drug stays in your system much longer. Older adults are also much more sensitive to these cognitive slowdowns. And mixing muscle relaxers with alcohol, opioids, or benzodiazepines, that is a dangerous, potentially life-threatening combination that can severely slow your breathing.
So the crucial point is understanding the mechanism, which brings us right to Section 4, quieting nerve pain with gabapentinoids. Okay, let's talk about gabapentinoids. These are anti-epileptic drugs structurally related to the neurotransmitter GABA. Doctors prescribe them for partial onset seizures, for sure, but they are incredibly common for severe, burning nerve pain too, the kind caused by shingles, spinal cord injuries, or diabetic neuropathy. These are heavy-duty drugs, and they work very, very differently than a basic pain reliever like ibuprofen.
So, how exactly do they stop nerve pain? Step 1, they bind to voltage-gated calcium channels on the nerve cells in your brain and spinal cord. Step 2, this physically reduces the amount of calcium flowing into those nerve terminals. Step 3, less calcium means a decrease in the release of excitatory neurotransmitters like glutamate and substance P. In plain English, they essentially calm down the abnormal electrical discharges and the pain signals racing through your nervous system.
The two heavyweights in this class are pregabalin, which you might know as Lyrica, and gabapentin, known as Neurontin. While they sound kind of similar, they are absolutely not directly interchangeable. Pregabalin is absorbed quickly, peaking within an hour, and has a very predictable linear dose response. Gabapentin takes 3 to 4 hours to peak, and fascinatingly enough, its bioavailability actually decreases as you take higher doses. Your body just stops absorbing it as efficiently.
Because of how differently they're metabolized, pregabalin is roughly 2.5 times stronger than gabapentin based on blood concentrations. This is exactly why you can never just swap one pill for the other on your own. Converting from one of these medications to the other requires really careful calculation and tapering by a doctor. And because both of them calm the central nervous system, they share common side effects: dizziness, drowsiness, and a noticeable loss of coordination.
All right, we've covered the biology and the side effects. Now let's bring this into its final, highly practical phase. Section 5, Safe and Alert Best Practices.
And this brilliantly illustrates the most actionable takeaways we've gathered from all our medical sources today. First and foremost, never mix these CNS depressants, whether we're talking muscle relaxers or nerve meds, with alcohol or opioids. It compounds the sedation to a really dangerous degree. Second, work with your doctor to time your heaviest doses for right before your planned sleep, which minimizes your daytime impairment. Third, always check your allergy meds to see if you are accidentally taking a D stimulant. And finally, for prescription nerve and muscle meds, never stop cold turkey. Taper off slowly under medical guidance to avoid severe withdrawal symptoms like anxiety, insomnia, or even rebound seizures.
Knowledge really is your best prescription. Whether you're battling spring pollen, a pulled back, or chronic nerve pain, these medications are amazing, powerful tools, but they come with a real biological cost to your alertness. So I'll leave you with this. The next time you reach into your medicine cabinet, will you know exactly how that little pill is talking to your brain? Thank you so much for joining me on this explainer, and stay curious.